Alright, so this is my presentation on treating an injury. So, the first step when treating an injury is to always be prepared. And to be prepared, you have to have first aid kit. And although first aid kits do come with disinfectants, it is always good to have an extra disinfectant with you. So in your first aid kit, some of the main things that they should have are hand sanitizer, of course, pain medication, Advil, ibuprofen, just depending on the type of injury, and anti-inflammatory gel, travel sickness bag, tea tree oil. I've actually never heard of that, but I guess that's supposed to be in your first aid kit. And then aloe vera, plaster, bandage, aqua ear, lip balm, gloves, antihistamine, and cotton pads. And alright, and then the types of disinfectants. So the main disinfectant is of course going to be alcohol, and alcohol, it comes in many different forms. Swabs, the little medical swabs you can get, the sprays, and they have many different types of brands and sprays that you can use. And the bottles, of course, this is any hard alcohol with a high alcohol content. Alright, so we're talking about alcohol. Now we're going. So after you've gotten the injury, the 3 steps are to identify, disinfect, and treat if possible. So the first step, identify. So there's 2 types of injuries. There's external and internal. So external, you're dealing with a slash or a cut of some kind. When internal, you're dealing with broken bones, bruises, any kind of thing dealing with muscles. And the next step is, of course, to disinfect. So based on the type of injury, research how to clean your injury. And with internal injuries, there isn't anything you can really do, so it's best to get to a hospital as soon as possible. When with most external injuries, any form of alcohol works as good as disinfectant. So to treat it, if the injury is internal, support wherever the injury is, especially if it is a broken bone, go to the hospital as soon as possible. If it's external, cover with a bandage to make sure it doesn't get infected. If you can see inside or there's profuse bleeding, then stop the bleeding and go to a hospital. Alright, that is the end.